all right? There are lots of treatments that we can do to correct this, but the PRP Vampire Facial or Facelift is really beats them all. She can get a great correction with just one treatment, and it doesn't have an expiration date. That's the other thing that she was asking me, like, when does it expire? It would expire as your body breaks down tissues as per normal. Unlike Botox or dermal fillers, which have a definitive expiration date of either 4 months to 5 months for Botox, or for fillers, which can be up to 8 to 2 years. Sometimes we got fillers up to 5 years, but they expire. But usually what I find is that it never goes back to point A. It's always a little better than where it started off, or a lot better than where it started off, but you may just need a little touch up. But with PRP, your body will break it down as per normal over the next couple of years. All right? All right, so let's go ahead and lie back. Yeah, I'm not going to use bicarb, I'll just use calcium. So there are some that says, you know, this is unproven science and all these types of things. PRP has actually been used for many years in other indications. The orthopedic surgeons have been using it since I don't even know, about over 30 years ago for bone grafting. So when they take a piece of bone out of you and they want to put it somewhere else, they would normally mix it with PRP, and it just helps the healing process. Also, it's been used in dentistry. When you get also the dental procedures, the dentists have been using it for quite some time. And it's only recently, I would say probably about 10 years or 15 years about, where it's been explored in other areas. Dr. Reynolds, who is the inventor of this particular procedure, he actually started with himself. He was noticing that he was aging, he was having some erectile dysfunction, and he injected himself. And he noticed that after that injection, he was able to aim and shoot for a period of time. And so therefore he perfected his procedure, and it evolves ever since. It's been researched in facial aesthetics. We have a few articles on that. Erectile dysfunction, the only article that you may find is a rat model where they actually did like a procedure that they would do normally for prostate cancer to remove the prostate, and they destroyed some of the nerves in the process, and they injected PRP around that area, and the rat in this case was able to get his erection back, and that's the basis of all of this. So one thing that we must be mindful of when we have these natural products is that Big Pharma is not going to invest millions of dollars in research to fix this, because they want you to get Viagra, they want you to get Cialis, and all the other medications that are associated with erectile dysfunction. For women with dyspareunia, they want you to go to see the gynecologist and get all sorts of surgical treatments for urinary incontinence, etc. When using your own body's ability to heal can sometimes help, and help tremendously. We're not going to say we're going to save the world with this, but from what I have done since 2014, everyone has seen a benefit. No one has gotten worse. Not all of it lasts as long as we would like it to, is reference to erectile dysfunction, but a year's worth of making it happen, I think that's great. And guess what? You just do it again, because it's your own body's blood. All right, so it's perfectly safe in that regards. So let's go ahead and start with the procedure. So her blood has already been taken and spun down in our special machine that's FDA cleared and approved. And we have it here. So here we have platelet what's called PPP, which is platelet poor plasma. And here we have the PRP. It has a little extra red in it because we got up a little bit more red blood cells, but nevertheless, this is concentrated platelet-rich plasma. And these are just these cells. Like if I was to cut you, the platelets come to the area and stop the bleeding and stimulate or call for the healing cells that help to repair and regenerate. And that's all we're doing here in the face. We're injecting the cells that call for repair, that can make the new blood vessels, the new collagen and elastin fibers. And we're injecting it in a concentration in an area that we want to regenerate. And it's just that simple. So we're going to activate the PRP with some calcium. And this just gets these cells active and getting them to secrete those growth factors that call for the cells to produce all those new tissues that we want to produce. So now that's all been activated. I'm going to put on the needle for the treatment, and we're going to start the injections. For those people that are squeamish, you can probably just close your eyes, but it's very well tolerated. So I'm probably just going to come to the side like this, if you can move this table. So once again, her face has been cleansed already. I always like to cleanse a little bit more with a little bit of alcohol, just cleansing. You can never be too clean. The only adverse effect that I've had is just a little bruising, and that's just from a needle injection, from a needle prick, nothing else. And we tell patients to sometimes expect a little bit of bruising, and if so, just wear some cover up and some makeup. But we do our best to try to mitigate it as much as possible. So I'm just going to do a slight injection. I'm going to place my finger in your eyeball socket just so you can feel comfortable that I'm not going in your eye with a needle. All right, slight injection now. How you doing?
So far, so good. I felt it.
All right, I'm just going to turn your head. I'm just going to do the other side. Once again, my finger is in your eyeball socket, so you know I'm not going to your eye. This part, they will kind of feel. The numbing medicine that we use is topical, so when I use the needle gun, which is going to make all these little small micro holes in her face, you're not going to be able to see them, but that's going to be not painful at all, but that's probably the worst part of the procedure. If we can mitigate that, that's great. So we're just filling in around her eyes. Remember we saw those little hollows in her eyes, so we're just going to soften that up with a little bit of PRP. All right, let me get that nasolabial fluid. Just a little bit of here, there and there. You all right? All right, you can turn to this side for me. You can do this side. And just the last one, so say no more pain. All right, good. So that's just a few injections, and now I'm just going to drip the PRP around her face. Who's the top for this? This is the dermal pen. So the dermal pen is going to create micro trauma, just a little injury to her face. This is nothing that you're going to be able to see once we cleanse off her face. But this is what's going to get those cells to start to repair and regenerate again. I'll just come behind her. All right, let's get some drops of PRP, please. I'm going to start applying. Just one. That's enough. Thank you. We can. The needle drops are adjustable. Let's get another Inco pad, please. Just the blue pad. And we're just creating that injury. And it just glides ever so nicely. Of course, you're going to get some erythema. That's the redness. Move the table from in front of the patient, please. Put it to this side. Of course, you're going to get some redness on her face because I'm creating some injury that's going to be creating some new blood supply. And this is all good. And this redness is probably going to go down in a few hours. We do a lot of soccer moms, and they do it on Friday, on Saturday, they go and do what they got to do for their children. and just put on some slight cover up or concealer, and they're good to go. You won't advocate going back to work after this because you'll be quite red and swollen. How are you feeling this?
Feels good.
All right. Yeah, this part, as I said, she won't feel because her face has been numbed. But you can imagine it being quite painful.
Feels like a massage.
Okay, good. I'm just adjusting the depth again. And I think of this when I'm doing it, like where I see all the wrinkles, I kind of go over them like I'm erasing them. Just got a little bit up here, just one drop. So you want to do the whole face. You don't want one face to be looking like it's 20 something. So we do the whole face. We get in around those crow's feet. Yep. Thank you. When Kim Kardashian did it, she was, you know, it was for TV, so of course you wanted to be dramatic, and she was screaming and hooping and hollering, but it's really not that bad, and that's the reason why we want people to come and see for yourself, as well as do it on Facebook Live, so you can know that it's really not that bad. Apart from the initial pricks, just in the areas of concern, that's all you're going to feel, and then the rest is just feels like a massage because your face has been properly numbed up. Let's do some on this side. Thank you, that's perfect. So we're making those little micro holes in her face, and as the PRP is being dropped in her face, it's going to be absorbed by the body, and it's going to stimulate that healing cascade. If I was just to inject the PRP without doing some sort of injury, then it won't work as well, because we actually need the body's, we need the injury to stimulate these cells to produce. So for women and men who are like, oh, okay, I want this for vaginal rejuvenation, what type of injury you're going to create to me? All right, let's put someone here. And for guys, for erectile dysfunction, what type of injury you're going to create? We actually have you use a pump for the men. And that pump you're going to use every day for 15 minutes. And you're going to engorge the penis to its maximum. And that's going to help to break off some blood vessels, cause a little bit of injury, and get a whole new set of blood vessels grown. You can have sexual activity for the guys with erectile dysfunction immediately after. Some people don't because you're a little numb from the numbing medicine, but the next day you're perfectly fine. And within a few days and a week or two, you will notice that you'll have increased sexual arousal. You will have a firmer erection. You would also notice that I'm just going around her nasolabial folds. You will also notice that you can grow an inch thicker and an inch wider. We don't always promise that, but that's been some of the things that we have seen over time. And Dr. Charles Reynolds has documented is that men say that, okay, I'm a little bigger. And that's not a problem either. Now for women, especially those who are in menopause, the O shot is especially important for those ladies because it's going to help to improve vaginal dryness. It helps with urinary incontinence. It also helps to improve your orgasms. We did it on a few ladies the other day when we had one of the assistants of Dr. Reynolds come down. And I don't know if I can say this because it's kind of graphic, but she's like, it feels like she was in her 20s again. And when she rides her bike, she has to wear a little napkin, a little pad. This is because the vibration stimulates her. And then she also likes the toy that she gets along with it to help with the Kyjuan exercises. It also helps to improve the elasticity, etc. So it comes with a medical device that you would insert. Okay. All right, just get a little bit down here. All right. right, and that's pretty much done. The procedure, the numbing up process, that takes a little bit longer. We're just going to take more of the PRP and just rub it on her face and let it absorb. And we're going to give her some of the PPP, which is that stuff we call the liquid gold as well. And she's going to take that home and rub it on her face. And that's going to help to numb up the face, improve the texture and tone as well. Also helps with a little bit of the stinging. But usually patients don't comment about a whole lot of pain at all. Just, you know, okay, my face feels a little sore. Well, that's about it. We give you some heavy moisturizers and some sunscreen, and you go about your way. Let's put that on top on that as well, and she can take that home with her. Okay. We don't cleanse the face afterwards because we want the cells to stay there and do what they have to do. All right, I'm just dabbing her so it's not dripping all over the place. But you can turn around and sit up.
See a difference?
well, you will. Let's relax your face.
Okay.
But you will see in and around the eyes because we filled them with PRP, and I'll probably take her in the back and do some more. So just save that for me, because I'll put some more here because I want that to be filled nice and full, and more around her eyes. But yeah, you're going to see just a filling effect, and also the redness and the swelling. But in the next couple of days, her face is going to be even more beautiful. Wow. So it's going to help with the texture and tone, fine lines and wrinkles. And all those pictures that you saw on the screen, which some of them are mine, some of them are other patients, other colleagues, this is real stuff. And after one treatment, you can see a dramatic difference. I normally give people an expectation, like 30 to 50% correction in some regards from after one treatment. All right? Well, thank you for being such a great sport.
Thank you very much for having me.
Any questions about PRP or any of our treatments? You can have a seat back down if you want. Any questions? Yeah.
Can I ask, how long is the spinning period? Like once you get the blood, can you explain how that works when?
Yeah. So once we extract the blood, we spin it down in an FDA approved kit. I think it's 5 minutes, 3 minutes on one spin, and then we take away the extra the red blood cells because it separates, right? And then we take the plasma and we put it in another vial and spin it down for 5 minutes. It really depends on the device that you're using. We have how many PRP kits here? About 4 or 5 PRP kits, because we've been doing this since 2014, and we keep on changing because we keep on wanting to get the better one that gives us better, consistent concentration. With all the PRPs that we do, we have a lab in the back. So we take the PRP, we put it in our CBC machine, and to see how much platelets we're getting, just so we can validate that we're actually getting a concentration 4 times the baseline.
So if I were to come in for a visit, then you could just extract my blood in 10 minutes, I can
Oh yeah,
procedure.
yeah,
Is that what you're saying? So it's one procedure, like.
Most definitely. For these types of procedures, we book about 35, 45 minutes, and you're in and out in that time frame.
So she came 35, 40 minutes.
But she came a little earlier because we had some. But she came in. We had some numbing. We gave her into the consent form. We answered all her questions. Yeah.
5 minutes
So
to
what
draw her
is it?
blood, and then
Yeah. It doesn't take long. 35 to 45 minutes is what we normally do it in. The scalp PRP is a little bit longer because we're doing hair restoration. It takes about an hour. We used to do it in 2 hours, remember? But because we've been doing it for so long now, we get it down to an hour because everyone knows the rule.
I just want to ask I'm not going to pronounce it right, but the formula you take home, how long can you have that on, and how do you store
Only for the
that?
day.
Only for the day?
Yeah. So tonight, she'll just go ahead and put it on because you probably feel your face getting tight now.
Yeah.
Yeah, so we'll just give her some of that to put on in just a minute. Actually, you can probably take it to the back and just put that on. Okay, you can follow Lindsay. Just so her face doesn't get dry, because she can just put that on and it's just going to absorb right into the skin. But that's only for the day. We don't tell you put it in the fridge and use it tomorrow. It loses its benefit. You have another question?
Can you publicize how much the procedure is? How much is it cost?
Oh, the cost? Yes, of course.
Yeah.
The cost for the PRP facial is $900, and that's the whole procedure. The PRP facelift, which is using some dermal fillers, is $1,550. So that's for the full procedure, the PRP and the dermal filler. If you need more fillers, then you just pay the additional price, whatever that will be, based on what type of filler you need at that particular point in time. The O shot for females is, I think it's $1,500, and that comes with the female device, and if you can go get the female device for me, and also the male pump for the men. And that comes with a device that helps. It's called the Apex device. It stimulates and helps you to does like your Kegels, if you will. And the men, it comes with the pump. I think men's about 2,000 for that P shot. Okay. Any other questions?
Sorry.
No, go ahead.
Apologizing.
It's okay.
How much do you do the procedure then for the joints as well? You
Oh, of
mentioned
course.
knee or ankle.
Of course.
Or shoulder.
I've done quite a few knees. I did actually 2 Achilles tendons today. And all of our patients with Achilles tendon tears or injuries have been having pain or for, I think this lady was over a year, and it's just never really healed. I've had other patients 6 months or more, and after 1 shot of PRP, they noticed a dramatic improvement in mobility and pain.
How much is it for the joints? Then for
Oh,
for knee or,
It's about 500 or less, depending on which joint.
Right. Okay.
For the joints. All right. Anything else? Yeah.
What happens if you take a anti-inflammatory medicine after, like you get injured or something, and you have to take?
You mean the PRP or?
Yeah.
Well, and that's a great question actually, because on the discharge summary we say no anti-inflammatories, because that inhibits really the healing response. We want the inflammatory cascade. We want the cells to come there that are supposed to repair and regenerate. So after you take like a Aleve, a Motrin, any of those products for an injury, you're actually somewhat halting the natural healing response in some regards. Of course, if that, see, it's not black and white, right? If that swelling and stuff is going on for 2 weeks or more, then that's kind of dysregulated. So you may want to probably take something at that point. But for the first few days, you know, just ride it out with some some heat and ice treatments, and just, you know, we'll also got the ocean that you can go in and plunge in, and that helps to regenerate and to heal as well. We don't know how it works, but it works.
So if somebody's regularly on, say, enteric aspirin as part of their doctor's regimen, they need to stop that? That's what you're saying?
No, I mean, well, we weigh the risk, right? A great new knee or a great new face is not going to be worth a heart attack or a stroke. So after the medical intake, we may tell you, okay, well, just go ahead and do it, or continue your aspirin regime. Some patients, they can do without aspirin for 2 to 3 days,
Right.
and that will be or 1 day in this regard, which is the day after.
Okay.
Mm-hmm.
Last question for you.
No, sure. I like questions.
For athletes, then is it accepted? It's not blood doping, is it?
No, not at all.
So
No.
how is it different then? So if someone were to, an Olympic athlete were to
Most of
test
them do this. Most Olympic athletes and also basketball players, football players do PRP, because we've shown that there's a lot of articles actually on orthopedics and tendinopathies.
Yes.
It's not so many articles on the other things that we talked about, but yeah, they're used commonly because it harnesses the body's ability to heal and repair.
It's not considered blood doping.
Oh no, not at all. It's your own body's product. The FDA actually has a ruling on PRP, and they say they don't discourage doctors from using it because it comes from the person's body, so there's no regulatory oversight for it. They just expect that the provider is well trained or has trained, is knowledgeable of the procedure, the adverse effects, and documents all of that. And you're free to use it as an off-label use because it's indicated only for orthopedics and dental procedures. That's the FDA indication. It's only for orthopedics and dental procedures at this time. Yeah.
So it's good for people that have arthritis in the leg?
Almost. In your neck? In the knees, yes.
Things like that?
Yeah, most definitely. I do it all the time for people with osteoarthritis. I never say that you're going to get a new knee, but in all of our patients, they have noticed a benefit. They notice a benefit and from the procedure. Now, so we're honest and open. Now, we're seeing 6 months to a year in reference to 1 shot. There's some doctors that do multiple shots over time, and that's pretty patient's choice. But you can do them as much as you can because you're not going to hurt yourself. As long as it's an aseptic technique where we're cleansing the knee, where everything's sterile, then you should be fine, and I haven't had any problems, knock on wood. All right, any other questions or concerns?
Like I have a plate in my leg and my knees, so I think my bones are not, it's not as strong as they used to be.
Mm-hmm.
So that's why it's a long time to heal.
Yeah, well, and that's why it's perfect, because we do a lot of more mature patients with either chronic wounds or osteoarthritis. You know, it just helps to slow down the rate of destruction. Because what are the treatments for osteoarthritis? Either tablets or medications. And then we inject steroids, and steroids helps tremendously, but it destroys the knee over time. You got Synvis oil, which is an oil to lubricate the knee, and that lasts for about 6 months to a year anyhow, but doesn't help to regenerate or repair. So PRP is the next best option before surgery, or if you're even thinking about doing something that's really going to help. We do a lot of young athletes, even in Bermuda, that have small meniscal tears. Put some PRP in there, and things heal tremendously. When they're small, when they're large tears, you need to get surgery. There's no doubt about it. But after surgery, this will help to repair, because inside the knee there's not much blood supply, so things have a difficult time healing. So we throw those cells in there, and it helps tremendously. All right. I mean, PRP is evolving. The indications that we use it for, once again, is for scalp or for hair growth, and those are all of our pictures that you saw. The P shot for erectile dysfunction, the O shot for females who want to get their groove back and feel lubricated again. We have injection in the knees and joints and tendons. They do it in ophthalmology. They do it for diabetic retinopathy. They inject PRP behind the eye, and it helps to regrow blood vessels behind the eye, and it helps with macular degeneration as well. I don't do that, but that's the eye surgeons that do those procedures. But it's used in so many different areas, and it's constantly evolving. But we're just waiting for someone to talk about its use in cancers. Injecting it into cancer cells is not something that we do, because we don't know how it works yet. People are using this in medicine now for those patients who have incurable cancers, who have nothing else to lose. And what I'm hearing is that it's helping them tremendously. You may think that injecting cells that stimulate the immune system into a cancer that's already dysregulated, it would be a bad thing, but what we're finding is that the body can heal itself if it's given the tools to do so. All right? And we'll see how that evolves. Big Pharma is not going to like that, and they're not going to promote it, and they're going to tell you that it's hogwash, because they're not going to make thousands of dollars off of your chemotherapy drugs. But that's the state of medicine at this point. What's natural and what can help you, and they don't make money off, they're not going to promote, and no one's going to give the money for the research to give the evidence to validate it. That's all. All right. Cool. Any other question?
You may have already answered this question, but somebody on your Facebook page asked, will this help improve rosacea in the face?
Oh, most definitely. Yes. It's actually indicated for rosacea as well. Acne, we use it in. Rosacea, we use it in. And what we find most commonly, especially in our population, the darkness around the eye, the hyperpigmentation around the eye. I just did a lady a few days ago, and she actually allowed us to take pictures and the video, so you'll see that up on our Facebook page soon enough. But it's indicated for that as well. Any other questions from the Facebook audience?
Is there any body's blood that you cannot use?
Not really. It's your own body's blood. If you was anemic, or you had, if you had any sort of blood cancers, of course we won't want to do that. Yeah, but that's really the only people that we won't be able to use it in.
How about people that have tattoos? Would you be able to do? I have a tattoo.
Oh yeah.
I've got 2 tattoos.
Yeah. She won't be able to donate blood, because that's the hospital's policy in reference to donating blood after having a tattoo. But we're using her own blood. We're taking it out, spinning it down, and just giving it back to her. So there's no problem at all. We would never give someone else's blood. We don't do that, because that would be inappropriate.
So with people with sickle cell, that's okay?
Yeah, well, with sickle cell, yes, you can still get it, right? Because it's not the platelets that have a problem, it's the hemoglobin. So the platelets are perfectly fine, generally. So you won't have any problems. Not at all.
One of your treatments said something about pig, something taken from
Oh,
pig.
very good. Thank you for that.
Yeah.
So we actually use, that's for scalp PRP only. So we actually use A cell. A cell is immunoprivileged cells from the bladder of a pig. So it's like the bladder stem cells. The bladder actually has enormous capacity to regenerate and to repair itself. So they take the stem cells out of the pig's bladder, and we mix it with the PRP and inject it into the scalp. And it has phenomenal results. It's used for wound healing as well. We have a lot of chronic wounds that can heal tremendously with PRP and A cell. What's the purpose of the A cell? A cell acts like a scaffolding. So it's like a sheet or a mold, and all the cells just start to grow on top of it like nothing we've seen before.
So there's no option. You have to use the pig bladder.
No, not at all. We have people that prefer not to due to religious reasons, and we have people that say, okay, I want everything. So it's optional, but it's only for the scalp, for hair growth and wound healing. Yeah.
Just one minute. Is there an age recommendation?
No.
Okay.
No. I think the oldest lady I did for her knee was about 80 something. Almost 80, 89. Because she was like, I'm not getting surgery. By no means. I'm too old for that. And she came here walking with her cane. She didn't have a walker. She had a cane. And then in 1 month, she came back for her follow-up. She was walking. She's like, I'm back dancing again. And that lasted for her for about 7 months. And that was great for her. And then we went and did it again. And there you go.
And how about on the younger spectrum?
The younger spectrum, because their disease, like she had advanced osteoarthritis. For younger people who are just having just minor tears or knee injuries or even minimal or minor osteoarthritis, it works tremendously for them.
Okay.
Yeah, it can actually, we don't say cure, but it can actually regenerate because it's so, the issue is very early. So with the adequate PRP can stimulate that that cartilage regrowth. They're actually doing studies now for patients with degenerative disc and spinal surgeries. And it helps to heal the area. It's not going to give you a new disc, but as they put in the prosthesis, they put the PRP around it and it helps everything to take a lot faster, reduces the recovery time and pain.
Okay.
Yeah. So, I mean, it's your own body's ability to heal. It's phenomenal. Your body, God made you in a perfect way and He gave you all the cells that can regenerate and to repair. Why not utilize or harness that to make things happen? Now, we also do breast enhancements, and everybody's like, I want to get a vampire breast lift. It's not as dramatic as you may seem. I've done 2 patients that have done it, and one lady, she was completely almost flat-chested, and she's had children, and what little breast she had was very saggy, and the skin around it was sagging as well, and she was like mid-40s, 50s. She didn't get a big new size, but what she noticed is that the skin around her breast was a lot firmer, they looked a lot better, and she was genuinely pleased with it. But it's not a lift as in big volume, not at all. You get volume for a few days after the procedure, then it goes down. But she also noticed that, I guess from having a few children, that her nipples wasn't as sensitive, and now she's like, I have to keep her shirt or something over her breast because they're not overly sensitive, but she's like, oh my God, I feel them again. So it helps to rejuvenate sensitivity as well. Okay. Cool. Well, if there's no other questions, we got a raffle. All right. Let's bring up the raffle. We always like giving away stuff. Now, October is Vampire Month. That's why we're launching it just in view of that, because it's Halloween and whatnot. So we're going to be running all sorts of specials for any of the vampire procedures. So take advantage of them while they're on special. And also, this is Spa Month. So you only got, 1 more week left in September, where we have different specials on different days, and you can get 15 to 20% off a lot of different treatments that we offer. So take advantage of that. And I think today is 10% off of dermatological products. So if you're a dermatological user, stock up on some products while you get this discount. It only lasts for the month of September. All right. Well, you guys have a great night. If you have any questions, you can just find me around the building. If you was kind of, didn't want to ask them in the group, I'll be in room 1 to answer any of your private or personal questions. All right?
If I get my knee done, when would I have to have it done again?
You would have to tell me. It doesn't. There's no definitive expiration date. You would notice that, okay, my pain is returned maybe 6 months to a year later.
Okay.
But definitely, I haven't seen anybody less than 6 months yet. And
were you going to demonstrate this too?
oh yeah. This is not to replace us, guys, but the women love it because after the treatment, they get one of these stimulators. It has electrodes that helps to strengthen the Kyjuan muscles, and a clitoral stimulator, and this just helps the PRP to take and to enhance the whole response.
Do you have any literature on the PRP for the men?
Yeah, we got pamphlets, and they're right there at the desk, and we'll probably hand them around, and you can take them. We have the facial ones, as well as the only one I don't think I have is the O shot. But for more information, you can just go to the website, Vampire Facial, Vampire Facelift, That's the official site of which you'll see me on, and you can find the information. This is the penile pump. So you have a sleeve here. You insert the penis. You turn on the pump. You engorge the penis until you get some sort of pain or discomfort. Then you let it down, and you do this for 15 minutes every day for a few weeks to a month, and you will notice tremendous results.
And you said that procedure is about 2,000?
Yes. Mm-hmm. Any other questions? All right. Well, I'm going to be in room 1 if anyone wants to come. We have our SPA team that's here, and they give you free face mapping if you want to know the texture and the tone of your face and what things you can do to enhance it. Everyone's trying to look young and stay young. Sasha, who's our spa therapist.
Hello, everyone.
She'll be in which room?
Room 6.
Room 6. So you just follow her on the corridor, and I'll be in room 1 if anyone has any private questions. Yeah. Thank you. All right. Have a great night, guys.
Thank you.